Okay, thank you. We're going to talk about part two. Those of you who do have the booklets, I'm not going to, again, I won't be able to cover everything that's in them, and I would strongly recommend that you, if you don't have one, you download it off the website, but that you take it away and you sit quietly somewhere and you read it, because I'm going to present to you arguments for and against what is referred to in the document as doctor-assisted dying, but which I will be calling euthanasia, and the abbreviation AVE you'll see on the screen sometimes as well, which, as I explained to you earlier, stands for active voluntary euthanasia, the only way I think the term should be used. And as David said, Alzheimer's Australia is not taking a position for or against this, but the organisation was aware that we're constantly having bills to legalise doctor-assisted dying presented to various state and territory parliaments around Australia, and they wanted the light shone on the issue, and that people be given the range of opinions in the community, the range of arguments in the community, and the responses to those arguments, so that if a piece of legislation hits your state, you will have the opportunity to think carefully about the arguments on each side, and perhaps even to influence your politicians one way or the other. My research actually demonstrated that there are 4 different community perspectives on this issue. Firstly, there's a reasonable sized group for whom it's all too hard, haven't made up their minds, can't think about it, don't know. But then there are 3 groups with strongly held positions. There are those who are totally opposed to euthanasia and they don't want the law changed. There's another group who are not opposed to euthanasia, but they don't want the law changed. Now, how I came to know about that group was when we did our research in Queensland, we simply asked, should the law be changed to allow active voluntary euthanasia for terminally ill people who decide they no longer wish to live? Now, you'll notice I haven't mentioned pain or suffering or anything else in that, and that's because when my colleagues and I started the research 20-odd years ago, we took a moral decision to stay neutral on this topic so that we could hear clearly what people on both sides of the debate are saying. I do have people constantly trying to push me into the pro-euthanasia camp because they say even asking the questions means you're pro-euthanasia. That's a load of rubbish. It's like anything else. If you try to prohibit something and you try to keep it hidden away, all you do is make it go underground. So we set up a committee with people who had viewpoints right across the spectrum. So in Queensland, should the law be changed to allow active voluntary euthanasia for terminally ill people who decide they no longer wish to live? Yes, no, not sure. 65% of the community said yes, 50% of the nurses said yes, 33% of the doctors said yes. However, I was then asked to go and do the research in the Northern Territory while the Rights of the Terminally Ill Act was in place up there. First place in the world to pass legislation that allowed both physician-assisted suicide and euthanasia. Because the legislation was in place, we actually asked, to what extent do you approve of the new legislation? 75% of the community strongly approved or approved, 50% of the nurses, 33% of the doctors. It's pretty consistent. However, how I came to know about that group who are not opposed to euthanasia but don't want the law changed, 2 of the doctors who strongly disapproved of the legislation. One said, I'm not opposed to euthanasia, but I don't think we should hand such a can of worms to lawyers and bureaucrats. Another one said, I've been helping my patients with this for years. We don't need a law about it. They were not saying they were opposed to euthanasia. They were saying they were opposed to euthanasia legislation. They didn't want the law peering over their shoulder in their relationships with their patients. Mind you, 2 of the community members who strongly approved, one said, tell the Commonwealth to keep out of our business, and another one said John Howard needs brain surgery. Now, neither of those were talking about euthanasia at all. They were talking about states' rights. Because if the Rights of the Terminally Ill Act had been passed in a state and not a territory, the Commonwealth could not have overturned it. Interesting. Okay, and then there are the third group, the third of those people with groups with strong viewpoints, and they're the ones who totally support euthanasia and they want the law changed. And I'm going to run you through the major arguments of each of those three groups. And for every argument, I'll give you what my research has been able to demonstrate, my own research and looking at the literature from other people, is the most common response against those arguments. As I said, I'd suggest you find a quiet place, read through the documents, have a bit of paper, and think about, well, do I agree with that argument? Or do I agree with the response to it? Where do I stand on this, and why? Don't be like a candle in the wind that you just get blown about with somebody's viewpoint. So let's look at those. So with that group who are in favour of euthanasia and in favour of changing the legislation, and I'm not going to them first because of any preference of mine or Alzheimer's Australia. This is just the way they ended up in the report. So the majority of their arguments come in first under the heading of compassion and relief from suffering. And they say the current law lacks compassion and mercy because it forces patients to continue to suffer. The main response to that is that palliative care can provide adequate comfort, and the real problem is healthcare providers who are inexperienced in palliative care. And you'll see that for all these arguments, there's something to be said on both sides. This group also say that death with dignity is an issue and that patients have a right to preserve their dignity and that hospital deaths can be undignified and families are left with traumatic memories. On the other hand, the people who don't agree with that say that preserving a person's dignity depends more on the attitudes of those who are caring for them than it does on the actual treatment received. Their next group of arguments come under the patient autonomy, self-determination and control heading. And they say that the right to self-determination and a desire for control over timing and manner of death is important to many people. And you'll see from the list I put up earlier that control is a big issue. When I did research in Queensland where I interviewed 43 carers of people who died in the previous 12 months and asked had anyone asked for assistance to end their lives, 6 people had. None of them had cancer. None of them really had severe pain. But 5 of them were ventilator dependent and all of them complained about loss of control. The response to that set of arguments is that the doctor's autonomy should also be respected, and I agree with that. However, I have to say that throughout the world, and including in Australia, anywhere where such legislation has been proposed or has been passed, doctors and nurses, it says in the legislation, are free to refrain from being involved. Nevertheless, I've had nurses tell me, well, that's all very well, but if my doctor orders me to do something, then I don't really have the freedom to refuse. Tricky one. And they say that the consequences for society should also be considered, and it's not just about one person's autonomy. They also, the group who oppose that argument, tend to suggest that physicians who don't know how to adequately relieve a patient's suffering might in fact agree to end the patient's life. Now the next one is probably the one, social justice is a big issue for me throughout life, through everything I do. And so the social justice argument is the one from group 1 that resonates most with me. And that is that the current legislation is discriminatory because a person can legally have treatment withheld or withdrawn knowing they will die, so in a sense being able to control the timing of their death. But someone who isn't ventilator dependent or machine dependent can't do that. Now, the response to that is that there is a moral distinction between taking life and withdrawing treatment which allows a person to die. I do have a bit of an issue on the social justice side, which I'll tell you right now, and that is if I wanted euthanasia, and I'd suggest perhaps if Charlie and Jill and some other people here did, we would know who to ask and how to ask. People who are reasonably well-heeled, well-educated, generally would know who to go to and what to say. The rest of the society wouldn't, and I'm not comfortable that I should have access to something that the rest of society doesn't. And it's interesting, isn't it, that the beginning and end of life are the messy times. And it reminds me of the old abortion debate where wealthy women didn't die in gutters after backyard abortions. They were referred by understanding GPs to sympathetic specialists. So that's one that does kind of resonate for me to some extent. not convinced totally. Okay. The need for openness, honesty and accountability. Families acknowledge off the record that a loved one received euthanasia, but because it's illegal, they can't grieve openly and honestly about it. That's the argument. And that openness would allow the development of better practice to improve end-of-life, or end-of-life care. The response to that is that even in places where euthanasia is practiced, there can still be complications. And if any of you have not read Roger Magnuson's excellent book, Angels of Death, The Euthanasia Underground, I would strongly recommend that you do. The issue about families is interesting. Sometimes families say, oh, yes, I know my loved one received euthanasia, when in fact was no such thing. And I have an experience from my own family. My father, when he was in hospital, my brother said to me after he died, you do realise I organised euthanasia for Dad, don't you? Excuse me? My brother is a staunch practising Catholic. My father died with his rosary beads in his hand. I'm thinking, you did what? And he said, I got to the hospital and Dad was in a lot of pain and I demanded that they increase his pain medication. I said, yes. And then he died from his ruptured aortic aneurysm. No, it was euthanasia. Had nothing whatsoever to do with euthanasia. And I kept thinking, why isn't he listening to me? Why does he not get that that wasn't euthanasia? And perhaps it was because he wanted to say, I love my dad so much I would even do that. But it wasn't euthanasia. And I think some of the other families who openly acknowledge it might not be either. Okay, and an expression of democracy. This one comes up quite a bit. The majority want it. And there's evidence from research and opinion polls that most people support the right of terminally ill patients to be assisted to die if that's what they want. The response is that some study designs are flawed and may not accurately reflect community views. Now, I do strongly agree with that because I have seen opinion polls that say, if someone's in unrelieved suffering with uncontrolled pain, should the doctor be allowed to help them end their life? No, they should sue their doctor. That's not the issue. People have a right to adequate pain relief. They have a right to adequate control of symptoms. What should happen is that the question there should only be, should the law be changed because the person's terminally ill and that's what they want, which is what we asked. Nevertheless, we still got majority agreement. So the next group, this is the group who, as I said, contain quite a few doctors. They're not opposed to euthanasia, but they don't want the law changed. And their arguments just come under a few headings. Fear of abuse and coercion is a big one. They're concerned that if it's legal, then people might be pressured into requesting it, maybe by their family to reduce the burden, or even if the family are okay about carrying the burden, they might feel guilty about it. So the pressure might be on themselves. By society to save the cost of care. And with an ageing population, there's a fear that people may have to justify not requesting euthanasia. And you know, there's a woman in the UK, I think her name's Baroness Warnock, who in a recent publication said, oh, people with dementia have a duty to die. Excuse me? No, they don't. We have a duty to care for them. Particularly most of them, in fact, will have spent their lives caring for other people, contributing to society, and they've earned our care and respect. That's not the issue either. And by health professionals who don't know what else to provide. And the response to that from people who want the law changed is that patients can already refuse treatment or ask for it to be withdrawn, and that can result in their death. And presently there is no legal, there's currently, this is currently legal, sorry, and there's no requirement to check for coercion. So somebody could be saying switch off the machine because they want to relieve the burden on the family. And there's no, and that's legal. And the other two headings, the argument headings from this group, slippery slope comes up all the time. People say, oh, once it's allowed for competent terminally ill people, it'll extend to non-competent people or people who someone else thinks life worth living. I've actually been to the Netherlands and other places and looked at their research and interviewed people. There is no evidence anywhere of a slippery slope. And I say that hand on heart. There is no evidence anywhere of a slippery slope. In fact, just the opposite in some ways, because one of my colleagues in the Netherlands, I asked her recently whether people were able to request euthanasia through their advance directive when they reached a certain point. And she said, yes, but it doesn't happen. And I said, why doesn't it happen? And that's because the law in the Netherlands requires prudent practice. And prudent practice with respect to euthanasia includes that the doctor is certain that the patient still wants it, that they've asked for it recently and continuously. And doctors are saying, well, how can we know that if it's in an advance directive that's been written 12 months ago or whatever? And she said the problem with that is that even though the law allows it, the patients are having to end their lives before they lose capacity because it's becoming known that they won't have that respected in an advance directive. So the slippery slope, I'm sorry, it's just not there. But carefully tested safeguards, people say can be adopted. There is no perfect system, but we would need to do our best. And that palliative care can control pain and other suffering is the other heading of arguments from this particular group. And they say that until all patients have equal access to palliative care, euthanasia should not be an option. Now, I would support that argument to the best of my ability to say, absolutely we need more palliative care, absolutely we need more resources for palliative care, we need more training in palliative care. Res care facilities should be using a palliative approach to care, and they need a palliative care champion in each facility. But the response, which is also valid, is that even when a patient is pain-free and with the best palliative care, some still ask for euthanasia because they've had enough and they reckon I should be able to go when I'm ready to go. Not the case at the moment, of course. And then the last group, those who are totally opposed. A majority of their arguments come in under the heading of religious conviction and belief in sanctity of life. Often they'll say, only God has the right to control life and death. It's never acceptable to intentionally kill an innocent human being. Interestingly enough, they'll often use the thou shalt not kill law, if you like, to support that argument. But someone told me that if you go back to the Hebrew, and I've gone and checked this out, and it's true, it actually doesn't say thou shalt not kill. It says thou shalt do no murder. Now, you might want to ask, is ending someone's life at their request for what they see as best interest to them murder? We have to ask the question. I can't give you the answer. But the response to the religious one also from those who want the law changed is that they say in a democracy no group should be able to impose their religious views on any other group. And of course I would think most of us would agree with that, because one of the lovely things about living in a country like Australia is that we have religious freedom and religious tolerance, and that if we have it, we should give it to other people as well if we want it for ourselves. And then the last argument, the next argument from this group, not knowing when requests are informed or autonomous, often they'll say things like, if people feel a burden and useless, then euthanasia might not really be a truly informed decision. It might be a despair situation. And there was a psychiatrist in Queensland who used to say anyone who asked for their life to be ended clearly had a mental illness. Well, that's a load of rubbish. Someone can make an absolutely legitimate request because they have decided that their quality of life is so poor that they see death as a better option. Now, you can see there are strong arguments on both sides of this debate, and you need to think them through clearly. Another argument, in fact the last two headings for this group, euthanasia would destroy patient and doctor relationship, that it's incompatible with the physician's role as healer. Others say it's absolutely not in conflict with the physician's role because that's to do everything possible to promote patient wellbeing and respect patient autonomy. And that it would increase the medicalisation of the end of life, and instead of allowing death to occur naturally, it would hasten death. The response to that, prolonging a person's dying with medical technology increases the medicalisation of end of life more than assisting them to die would. So they're the major groups, the major arguments, the major responses. But there's a lot more than that in the booklet, which I strongly suggest that you read and think about. But there are some specific issues for people with dementia that we all need to be very aware of and think about. Being diagnosed with dementia could cause distress that might trigger a request for euthanasia. So we would want to be absolutely certain that the safeguards, such as were in the Northern Territory legislation, are there. In the Northern Territory, people had to ask repeatedly over a period of time, which was at least 2 weeks. The person had to be seen by not only their treating doctor, but a specialist in that person's disease. They had to have a psychiatric assessment. They had to have a palliative care assessment. And we would want to, I would hope everyone would want to be certain that someone with dementia over at least a period of time is assisted to know that they can have a good quality of life for quite a few years after the diagnosis and still have capacity for quite a few years. There is a fear that with cost of care being higher for people with dementia, that it might drive policy. Again, we just need to be alert to that. And I've already made the point about pain. If someone's requesting it because of inadequate pain, then no, that should not be a reason for granting the request. That should be a reason for getting adequate palliative care and pain management for the person. But the next two will require a lot of discussion if such legislation ever is passed. And let me say to you that all the research I've done suggests it will be in Australia at some stage, because when I did ask the questions in the Territory and in Queensland, it was an absolutely linear response. The 18 to 29-year-olds, it was up to about 85% saying yes, the law should be changed. It was down to about 65% for people over 75. So if it's a cohort effect, as that group moves through society, the law will change. If, however, the closer you get to the issue, the less sure you are about it, maybe it won't. So we need to be certain that if it's legalised, should a request made in an advance directive be honoured? Think about that. And should someone else, your medical agent, for example, your medical power of attorney, should they be able to request it for someone? So that's the end of what I'm going to tell you right now. The contact details for me, for Alzheimer's, for the National Helpline, Alzheimer's Victoria will have that, and you can get those if you want. But I do want to acknowledge the Alzheimer's Australia National Consumer Advisory Committee. When I was first told that I needed to work with a committee on these reports, I took a big gulp, because you know that a camel is a horse designed by a committee. And I thought, ooh, but in fact they were wonderful. They knew a lot more about this than I did. Most of them had been carers. They had insights that I never would have had on my own. I also need to thank my senior research officer, Dr. Sonia Brownie. Every so often Sonia gets a call from me, as she did this morning. Son, quick, can you check the Victorian legislation for me and make sure it says X, Y, Z? And she's been brilliant too. Thank you.